ਕੈਨੇਡਾ ਦੇ ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਜਸਟਿਨ ਟਰੂਡੋ ਨੇ ਕਿਹਾ ਕਿ ਕੈਨੇਡਾ 'ਚ ਵੀ ਬਾਕੀ ਹੋਰ ਦੇਸ਼ਾਂ ਵਾਂਗ ਕੋਰੋਨਾ ਵਾਇਰਸ ਦਾ ਪ੍ਰਕੋਪ ਦੇਖਣ ਨੂੰ ਮਿਲ ਰਿਹਾ ਹੈ। ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਅਜੇ ਵੀ ਇਸ ਦੇ ਕੇਸਾਂ 'ਚ ਵਾਧਾ ਲਗਾਤਾਰ ਹੋ ਰਿਹਾ ਹੈ। ਕੱਲ ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ 'ਚ ਸਭ ਤੋਂ ਵੱਧ ਕੇਸ ਸਾਹਮਣੇ ਆਏ। ਉਹਨਾਂ ਕਿਹਾ ਕਿ ਇਸ ਤੋਂ ਪਹਿਲਾਂ ਓਨਟਾਰੀਓ 'ਚ ਸਭ ਤੋਂ ਹਾਈਐਸਟ ਕੇਸ ਰਿਪੋਰਟ ਕੀਤੇ ਗਏ। ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਇਸ ਤਰ੍ਹਾਂ ਦੇ ਹਾਲਾਤ ਬੇहद ਗੰਭੀਰ ਹਨ।
Are still rising. Yesterday, both British Columbia and Saskatchewan announced a record high of daily new cases. On Wednesday, Ontario reported their largest number of new COVID-19 related deaths in a single day since the beginning of the second wave. I can't stress this enough. This situation is serious. These are not just numbers. These are people's grandparents, parents, and loved ones. We all have our own reasons, our own loved ones that we want to look out for and protect. I just got news last night that my godfather and uncle, Tom Walker, had to be readmitted to hospital last night. He's been in and out of hospital over a while, and I'm sending him my love. And we're all thinking about our loved ones who we haven't been able to see for many months, who we're worried about. We all have our reasons to keep each other safe, to follow public health advice. We need to do that. It's particularly nice outside in many parts of the country this week, which means we're still enjoying lots of fresh air. But winter is coming. And that means we're going to have to get into more enclosed spaces. We're not going to be able to open windows wide in rooms. Ventilation is going to become much more important. We need to remember to be careful. There is increasing evidence that aerosol spread is a vector of transmission. We need to wear masks. We need to avoid crowded, closed spaces, as Dr. Tam has said many times. We need to make sure we're making it into winter on a good footing so we can hold on through winter. The vaccines hopefully will be here in the spring, but there's a lot of work to do between now and then to make sure that we're keeping Canadians safe and healthy.
ਕੈਨੇਡਾ ਦੀ ਚੀਫ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਥੈਰੇਸਾ ਨੇ ਕੈਨੇਡਾ ਅੰਦਰ ਕੋਵਿਡ-19 ਆਊਟਬ੍ਰੇਕਸ ਬਾਰੇ ਜਾਣਕਾਰੀ ਦਿੱਤੀ। ਉਹਨਾਂ ਕਿਹਾ ਕਿ ਕੈਨੇਡਾ ਅੰਦਰ ਕੋਰੋਨਾ ਪੋਜ਼ਿਟਿਵ ਮਰੀਜ਼ਾਂ ਦੀ ਗਿਣਤੀ 2,52,333 ਹੋ ਚੁੱਕੀ ਹੈ। ਕੋਰੋਨਾ ਕਾਰਨ 10,318 ਵਿਅਕਤੀਆਂ ਦੀ ਮੌਤ ਹੋ ਚੁੱਕੀ ਹੈ। ਡਾਕਟਰ ਥੈਰੇਸਾ ਦੇ ਦੱਸਣ ਅਨੁਸਾਰ ਕੈਨੇਡਾ 'ਚ 33,000 ਦੇ ਕਰੀਬ ਐਕਟਿਵ ਕੇਸ ਹਨ।
Been 251,338 cases of COVID-19 in Canada, including 10,381 deaths. Nationally, there are close to 33,000 active cases across the country. Over the past week, labs across Canada have tested an average of close to 61,000 people daily, with 4.7% testing positive. The average case count is now over 3,350 cases reported daily over the last 7 days. There are also increased numbers of people experiencing severe illness. Over the past 7 days, there were on average 1,200 individuals with COVID-19 being treated in Canadian hospitals, including 225 in critical care, and an average of 44 deaths were reported each day. As I mentioned earlier this week, I am cautiously optimistic that safe and effective COVID-19 vaccines will be available in the first quarter of 2021, bringing us one step closer to the widespread and long-term management of COVID-19. I would like to emphasize that when vaccines become available, there will be a limited supply at first. While that supply will continue to increase over time, it does mean that federal, provincial, and territorial governments will have to make important decisions on how to use the initial vaccine supply. The National Advisory Committee on Immunization, or NACI, is a long-standing expert advisory group that provides independent guidance and recommendations to inform these kinds of tough decisions. On Tuesday, NACI provided preliminary guidance on the key populations that should be considered for early COVID-19 immunizations, including people at high risk of severe outcomes or those at high risk of spreading to them. Work is essential to maintaining the COVID-19 response or other essential services for the functioning of society, and people whose living or working conditions put them at elevated risk of infection and its disproportionate consequences, including Indigenous communities.
ਓਨਟਾਰੀਓ ਦੇ ਪ੍ਰੀਮੀਅਰ ਡਗ ਫੋਰਟ ਨੇ ਓਟਾਵਾ ਦੇ ਸਿਵਲ ਹਸਪਤਾਲ 'ਚ ਪੱਤਰਕਾਰਾਂ ਨੂੰ ਸੰਬੋਧਨ ਕੀਤਾ। ਇਸ ਦੌਰਾਨ ਪ੍ਰੀਮੀਅਰ ਨੇ ਐਲਾਨ ਕੀਤਾ ਹੈ ਕਿ ਓਨਟਾਰੀਓ ਸਰਕਾਰ ਹਸਪਤਾਲਾਂ 'ਚ 254 ਹੋਰ ਬੈੱਡਾਂ ਦਾ ਵਾਧਾ ਕਰਨ ਲਈ $45 ਮਿਲੀਅਨ ਦਾ ਨਿਵੇਸ਼ ਕਰਨ ਜਾ ਰਹੀ ਹੈ। ਪ੍ਰੀਮੀਅਰ ਫੋਰਡ ਨੇ ਮਹਾਮਾਰੀ ਬਾਰੇ ਗੱਲਬਾਤ ਕਰਦਿਆਂ ਦੱਸਿਆ ਕਿ 7 ਨਵੰਬਰ ਨੂੰ ਕੋਵਿਡ-19 ਪ੍ਰਣਾਲੀ ਅਧੀਨ ਸੰਤਰੀ ਪਾਬੰਦੀ ਵੱਲ ਵਧੇਗਾ, ਜਦਕਿ ਪੀਲ ਖੇਤਰ ਨੂੰ ਰੈੱਡ ਜ਼ੋਨ ਵਿੱਚ ਦਾਖਲ ਕੀਤਾ ਜਾਵੇਗਾ।
as well as all of our frontline workers at our Ottawa hospitals and long-term care homes. You're absolute champions. You've been true heroes over the past few months. And Mayor Watson, it's great to see you again, and thank you for our many great discussions we've had. We've been listening to you and to the people of Ottawa, and I'm here today with our Minister of Finance, Rod Phillips, our Health Minister, Christine Elliott, and all of our local champions, Minister Lisa MacLeod, Minister Marilee Fullerton, MPP Goldie Gamari, and MPP Jeremy Roberts. I always say Ottawa is well represented because we've made incredible progress here in Ottawa. A few weeks ago, when we first saw the second wave that hit Ottawa, we worked closely with Mayor Watson, Dr. Etchus, and our team to quickly bring in targeted action to stop the spread of COVID-19. And thanks to that early and necessary action, we're now seeing real improvements. And I was talking to the mayor the other day, and it's amazing when people band together what they can do. New cases in Ottawa are trending down. People are following the rules. And I agree with Mayor Watson and Dr. Etchus 100% when they say we have to find ways to make sure we keep our schools and businesses open while protecting everyone's health and safety. That's why, effective tomorrow, I can confirm that Ottawa will be moving to the orange restrict level of our new COVID-19 response framework. This means Ottawa restaurants, bars, and gyms will be able to reopen tomorrow, provided they follow public health measures. York Region will be joining Ottawa as Eastern Ontario Health Unit moves to yellow protect level. That's because of improving public health trends. After consulting with local medical officer of health, our Chief Medical Officer of Health, and in line with the clear indicators outlined in our new COVID-19 framework.
ਓਨਟਾਰੀਓ ਦੇ ਵਿੱਤ ਮੰਤਰੀ ਰੋਡ ਫਿਲਿਪਸ ਨੇ ਦੱਸਿਆ ਕਿ ਕੱਲ ਅਸੀਂ ਕੋਵਿਡ-19 ਰਿਸਪੌਂਸ ਦਾ ਦੂਜਾ ਪੜਾਅ ਐਲਾਨਿਆ ਸੀ। ਉਨ੍ਹਾਂ ਕਿਹਾ ਕਿ ਓਨਟਾਰੀਓ ਦਾ ਐਕਸ਼ਨ ਪਲਾਨ ਹੈ ਸੰਭਾਲਣਾ ਅਤੇ ਸੁਰੱਖਿਅਤ ਰੱਖਣਾ। ਉਨ੍ਹਾਂ ਕਿਹਾ ਕਿ ਇਸ ਪਲਾਨ ਦੇ 3 ਪੜਾਅ ਹਨ। ਪਹਿਲਾ, ਵੱਧ ਤੋਂ ਵੱਧ ਇਨਵੈਸਟਮੈਂਟ ਕਰਕੇ ਲੋਕਾਂ ਨੂੰ ਸੁਰੱਖਿਅਤ ਰੱਖਣਾ। ਇਨ੍ਹਾਂ 3 ਪੜਾਵਾਂ 'ਚ ਖਰਚ ਕੀਤੀ ਜਾ ਰਹੀ ਰਾਸ਼ੀ ਬਾਰੇ ਵੀ ਫਿਲਿਪ ਨੇ ਜਾਣਕਾਰੀ ਦਿੱਤੀ।
Yesterday, I announced the next phase of our government's response to COVID-19, Ontario's action plan, Protect, Support and Recover. Our plan has 3 pillars. First, we are taking steps to protect people from the deadly virus by increasing our investments in healthcare to $15.2 billion. Second, we are building on the early relief provided for a total of $13.5 billion in direct support for families, workers, and employees, and that's in addition to $11.3 billion in cash flow support. And third, we are removing barriers to recovery and providing $4.8 billion to protect and create jobs now and in the future. This next phase of Ontario's action plan brings the total COVID-19 response by the Government of Ontario to $45 billion over the next 3 years. Protect is the first pillar of our plan, and today's $45 million investment in those 254 beds the Premier mentioned in Ottawa is just one example of how we are doing what it takes to continue to protect people from COVID-19. The people of Ontario have done and are doing their part, including here in Ottawa, by respecting and following public health advice. And our government is doing ours. In total, we're spending $8.3 billion more to protect our frontline healthcare heroes and protect people from COVID-19. This does include supporting 141 hospitals and healthcare facilities, 626 long-term care homes since the pandemic began. As we announced yesterday, this includes an additional $572 million more to ensure Ontario's hospitals have the necessary resources to continue providing care for those who need it. And that means in total, our hospitals receive $2.5 billion more than they received last year. Since March, working with our hospital partners, we've added an additional 3,100 beds to help communities be prepared for scenarios. That includes, of course, the 2,200 the Premier mentioned most recently added. Ontario has built the most robust testing network in the country.
ontario ਦੀ ਸਿਹਤ ਮੰਤਰੀ ਕ੍ਰਿਸਟੀਨ ਇਲੀਆਟ ਨੇ ਦੱਸਿਆ ਕਿ ਕੋਵਿਡ-19 ਦੇ ਦੌਰ ਵਿੱਚ ਸਾਡੀ ਸਰਕਾਰ ਨੇ ਬਿਹਤਰ ਤੋਂ ਬਿਹਤਰ ਕੰਮ ਕੀਤੇ। ਉਹਨਾਂ ਕਿਹਾ ਕਿ ontario ਵਾਸੀਆਂ ਨੂੰ ਹਰੇਕ ਉਹ ਸਹਾਇਤਾ ਦਿੱਤੀ ਗਈ ਜਿਸ ਦੇ ਉਹ ਹੱਕਦਾਰ ਸਨ। ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਇਸ ਕੰਮ ਨੂੰ ਜਾਰੀ ਰੱਖਦੇ ਹੋਏ ਸਰਕਾਰ ਹੈਲਥ ਕੇਅਰ ਲਈ $45 ਮਿਲੀਅਨ ਹੋਰ ਖਰਚ ਕਰਨ ਜਾ ਰਹੀ ਹੈ। ਇਸ ਨਾਲ ਹਸਪਤਾਲ 'ਚ ਸਹੂਲਤਾਂ ਦਾ ਵਿਸਥਾਰ ਕੀਤਾ ਜਾਵੇਗਾ।
Our government will do whatever it takes to protect the health and well-being of Ontarians and ensure they have timely access to the care they need close to home. That's why we are investing nearly $45 million to create up to 254 more hospital beds in Ottawa. This includes 39 beds and 20 ambulatory offload spaces at the Ottawa Hospital, 120 beds at the Greystone Village Retirement Home, 56 beds operated by the Queensway Carleton Hospital, 10 beds at Hôpital Montfort, and 9 beds at CHEO. Today's funding also includes over $16 million to build the new Emergency Department Ambulance Offload and Medicine Transition Unit facility here at the Ottawa Hospital Civic Campus, and $1.5 million to hire dedicated offload nurses at 4 Ottawa area hospitals to support paramedics transferring the care of their patients to hospital staff, allowing them to respond to the next 911 call more quickly. Through these investments, our government is increasing hospital capacity and reducing wait times for patients and families in the Ottawa region, and ensuring our health system is able to respond to COVID-19 outbreaks and help patients waiting for surgeries and other procedures. So thank you, and I would now like to invite my colleague, Minister Fullerton, to say a few words.
ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ। ਪਲੀਜ਼ ਸਾਡੇ ਚੈਨਲ ਸਾਂਝਾ ਪੰਜਾਬ ਨੂੰ ਲਾਈਕ ਤੇ ਸਬਸਕ੍ਰਾਈਬ ਕਰੋ YouTube ਤੇ।